Rentschler Biopharma is a contract development and manufacturing organization. We produce drugs for a variety of diseases. We have over 130 different protein formats, and we focus on serious and rare diseases. There is definitely data literacy in the whole organization. I don't think that there's an exception. And we of course profit from that. Our task is always to reduce the time frame, the time to market, to be as fast as possible and at the same time as reliable as possible. What we definitely need is a robust process. Downstream development is responsible for developing the way we purify the proteins as pure as possible with as high yield as possible. It's very important that we understand the process, that we understand which factor influence our product, and we use statistics for that. In essence, what we do is very frequently more or less the same. And what we don't want to do is inventing the wheel all the time. Automatization is extremely helpful, that you go through a specific workflow very fast, in best case with one click, and generate these standard analytics. Automation, it also eliminates a little bit the human error. If we have digital data, then I can go with an automatic workflow all the way to the report, because no human can type something wrong in the middle. Automation helps a lot to really prevent these errors. It's just excluded. I'm now, for example, developing some JMP journals, which gives you some workflow. And there you might have 4 steps with 1 button each. And that really guides you through the process. And then you have some kind of best practice automatically applied. There's no reinvented. It is now done easier and then always the same way. More valuable than anything else is that everybody uses the same software. Otherwise you have silos of different departments not communicating. There are also so many questions which are very similar in different departments. And you can transfer your solution also to a different department. And that you can only do if they use the same software. I think it's rather easy to use and easy to use for everybody. So I think it's a good compromise that you have a good statistic platform, but also the visualization. It is very demotivating when you have one group generating the data and the second group's analyzing the data. It makes so much more sense if you just train everybody who wants to know more about statistics, than in this case more about JMP. When you think about the pharma level, our experiments are insanely expensive. So when we can just save a few experiments by having better models, we save a lot of money. That is far more than a license. And if we can prevent a single batch failure, we cannot even buy so many licenses to invest that into a single batch failure. I enjoy that we have the ability to really develop new things and to improve ourselves, our products. And it's very valuable to have a culture which is encouraging to learn and encouraging to improve and to become better. Not to be stuck with processes which we have done always, but to really question why do we have the processes and how can we get better. I think we are not at the end of digitalization, we are at the beginning of digitalization. It will become better every year. And we just have to be open to improve our workflows. And I love my job because it's extremely versatile. It's always something exciting. I really love to do stuff which has an impact, and that's pharma industry is a great example for something which has a positive impact, which allows me to grow and apply my skills. And I think, first of all, you need the task, but you also need the freedom to solve the problem in the best way.